Now, your local weather forecast. Stick with us. News Talk 1480 WHBC.
Here's your AccuWeather forecast. Sunny, breezy. High today at 64. It'll be clear and chilly this evening. Low tonight 38. Sunshine, nice day tomorrow. The high 75. Clear tomorrow night, low 58. On Friday, breezy, passing shower. An afternoon thunderstorm possible. The high Friday afternoon, 75. Get your weather news when and how you want it at AccuWeather.com. I'm Steve Williams for News Talk 1480 WHBC.
Sourcebook is here. It's the area's most valuable resource guide for residents and businesses alike. Get your Sourcebook at the WHBC studios or log on to WHBC.com for a list of pickup locations. Pick one up today.
Live from the WHBC Broadcast Center. Find out more about area businesses, agencies, and events.
It's what's going on right now.
This is Spotlight.
And good morning, everyone, and welcome to Spotlight on this beautiful Wednesday morning. I'm Pam Cook with you this morning. And again, don't forget, when we have our Spotlight program, you can always listen on the radio, of course, but you can watch us on our YouTube channel. Just search 1480 WHBC on YouTube. And also, you'll find us live right now on Facebook, just like our Facebook page at 1480 WHBC. So today we want to shine the spotlight on a local business, Crystal Clinic Orthopedic Center. Happy and excited to share some information with you. And today I have with me from Crystal Clinic, Dr. Thomas J. Dr. Carrie Diulis, and also Dr. Travis Cleland. Welcome, guys.
Hi there. Hi.
So before we get started, I would like each of you to kind of go down the line and just give me a little bit of background about yourself. We'll start with you, Dr. Riley.
Well, being the senior guy here, I'm also one of the original founders of the Crystal Clinic back in the late 80s. 1989 is when we started. I'm a microvascular orthopedic hand surgeon with my specialty focused on problems below the elbow, basically. Historically, I've treated children all the way to patients over 100 years old for various problems, from birth defects to trauma injuries to arthritis conditions and more of the chronic cumulative trauma conditions like carpal tunnels or tendinitises as well.
All right, and Dr. Diulis.
Hello, I am an orthopedic spine surgeon. The focus of practice, so it's a fellowship that's after orthopedic training. The focus of my practice is on degenerative conditions that happen of the neck and the lower back, but also on fractures that can happen in the spine that are related to osteoporosis that we see more commonly in older women, and then also in men who reach a certain age. So they're much more common in women than they are in men, but we see them in both. And so that's really where my focus is. There are a lot of things around the pelvis that can cause pain. And sometimes it's coming from the spine. Sometimes it's coming from problems with the muscles around the pelvis or the hip joints, but sometimes it's from insufficiency fractures of the pelvis themselves. So that's part of the job, is teasing out where is that pain coming from.
All right, and Dr. Cleland.
Hi, I'm Dr. Travis Cleland. I'm one of the physical medicine and rehab specialists here, and I take care of the non-surgical musculoskeletal care, as well as being the director of bone densitometry. So I assist with the diagnosis of osteoporosis, but I also work with electrodiagnostic testing to determine if there's any nerve issues or any nerve entrapments, as well as diagnostic and interventional ultrasound for non-surgical orthopedic issues.
All right, and Dr. Riley, I want to start with you when we discuss Crystal Clinic as a whole, because you are one of the founders, and talk about how it all came about for you, and what the mission is.
Well, we're all blessed in Northeast Ohio with excellent medical care, the big names that are out there. But even in Akron, Ohio, I'm from Southern Ohio. I grew up in Cincinnati, but Akron was known as a center of orthopedic care way back in the 60s and 70s. even though Akron's a smaller community, they were very much dedicated to orthopedic education. And because the education was so good, the level of orthopedic care also rose very high. And with that, it attracted many of us from out of the area to come to Akron for training. And as most of your audience knows, it's nice. It's a nice place to live, a nice place to raise a family. I have 7 children, so we very much like the area. And my wife and I decided to come back and settle here. The orthopedic care then, as we looked around, it was really kind of fragmented. And the vision in the late 80s was to have a one-stop location for both orthopedic evaluation and care, not only operative surgery, but also non-operative care, with the big focus, and we were early on in this, for preventative care for preventing injuries such as fractures related to osteoporosis, and also training to keep our athletes healthy so they don't get hurt. So we were incorporated with physical medicine very early on. We had physical therapy there for training. And then fairly early on, we did our own diagnostics for osteoporosis and fractures that might be put off from happening by diagnosing early who was at risk. And we then gathered specialists in the different subspecialties: hand, total joint, spine, pediatrics, foot and ankle, sports medicine. We had shoulder specialists, cutting edge doctors in arthroscopic surgery early on in the knee, and then eventually shoulder, and now even hip surgery that can be done arthroscopically. These are all cutting edge things that the Crystal Clinic was at the forefront, not only nationally. Dr. Laskowski has people coming in from around the world to watch him do hip arthroscopy and repair soft tissue injuries in the hip that previously we had trouble diagnosing, and now we're repairing them arthroscopically. So it's been a journey, starting out as a kind of crazy vision where a bunch of doctors in Akron decided to start with a building where we all came together in 1989, eventually had our own in-house surgery, which was one of the first outpatient orthopedic surgery centers in the country. And then it's evolved from there till recently in November of 21, we built our own freestanding hospital for orthopedic and reconstructive plastic surgery right down the road here on Embassy Parkway on the west side of Akron.
And we should be clear that you are physician owned, just so people understand that, correct?
And I think that was always a differentiator for us. We had this vision, but we are the ones that see the patients. We're the ones that touch the patients. We're the ones that listen to the patients. Decisions are made by doctors in a boardroom, but they're oh, there we are. That's our new hospital that we just opened in November. It's an amazing place. Even if you don't need orthopedic care, come in and get some food. The food's really good. We're thinking about making it a bed and breakfast on the weekends. But really, I think that the doctors separated, not being employed, we're dedicated here. This is my 38th year in working with orthopedics at Akron as a private practice physician. And with Crystal Clinic now, we're in our 34th year of existence. And that's pretty remarkable when you look across the country, how systems kind of come and go, different owners, hospitals closing. And we've just kind of plodded along with doing our thing. And our rankings are nationally now recognized by Medicare as high quality outcomes and patient satisfaction that really put us above the big name players. We kind of joke that we're the clinic with the small C versus the clinic with the big C. But those guys that I know very well from the bigger organizations just say, how do you guys do this? And I said, you just surround yourself with like-minded people like Dr. Cleland and Dr. Doulis and the rest of my partners. And it's just amazing. It's been a tremendous journey. And
I would say that you probably have seen a lot of growth over the last several years. I mean, talk about growth, and maybe you've already mentioned accomplishments, but are there any other ones that you want to highlight?
Well, I think I think part of what I always said, and even when I would talk with administrators of the bigger systems, our ability is adaptability. We're able to change with things that change, and the push to outpatient care. We were right in the front end of that back in '89 when we had our surgery center. Now the hospital's geared for short-term stays or observational care. So it's less cost, but yet high quality which is important. You can't sacrifice quality for cost, and I think that's been a real important part of what we've done. But our expansion has been dramatic in terms of just locations. We're in 6 counties now throughout Northeast Ohio. Down your way, we have an office now south of Belden in Canton that does the whole spectrum of orthopedic evaluation and plastic surgery evaluation. We do MRIs at that location, physical therapy at that location. And then just a little bit north of you in Green, we have a office as well. And then we go all the way to, we have offices in up in Ashtabula, we have offices in Warren, offices in Medina, Portage County, besides our center here in the west side of Summit County.
We have to talk about outcomes too, because obviously you can do all of the work for a lot of different people, but if the outcomes aren't there, then that's an issue. But you guys have had quite a bit of success with the outcomes, obviously.
Well, and I think it's important as your audience kind of checks out where to be taken care of, they kind of try to find something that's an objective measurement. And the government, through the Medicare Center for Medicare Medicaid Services, does assessment and actually does real science measurements. And we're in the top 1% nationally for outcomes for our patients. And that's pretty nice when you figure we're 50 subspecialists here in Akron, Ohio, based throughout Northeast Ohio, that we do that. And it's a team approach. It's not just our doctors, it's our nurses, it's our assistants, it's our clerical people, it's our non-physician leadership. So it's very much a team approach. We have 1,100 employees throughout our 20 locations now. And I think the teamwork, a lot of us played sports at different levels, and I think the team approach that we have is what makes us great. The old saying, it's not original, but teamwork makes the dream work, is very much true. And I just love that phrase, because the dream was late 1980s. Dr. Gradisar, Ivan Gradisar, his son now, Ian, is working with us, but he was one of the founders, and it was 100 meetings over a year and a half before we opened our doors, designing and planning. And the meetings have not stopped over the last 34 years.
And you know what, I would imagine that approach also makes patients feel more comfortable, because they can probably feel that coming from you guys.
Well, as big as you get, and I kind of, there was a big like, oh my gosh, how wonderful during COVID where you could do a visit online. And I just kind of, through my different things through LinkedIn or Facebook, I say, no, whoa. The medical students are having trouble doing physical exams right now. Holding your hand up to a computer screen and said, it hurts right here, doctor. That's not the direction we need to go. I mean, if you have to, great. And some of our doctors are now seeing patients from around the country virtually, which is better than nothing. But still, going back to Greek times, you wanted to lay your hands on the patient, comfort them. Sometimes I spend my whole visit talking about someone's losing their spouse, not about their carpal tunnel syndrome. But that's part of what we try to blend, the high tech with the patient touch. And I think being physician owned and operated is what makes us kind of stay true to that. We're not employed. We don't punch a clock. And that's proof. Just ask our families what time we get home at night. But it works. Our families might sacrifice, but our patients benefit.
All right, we're going to take our first break. When we come back, May is National Osteoporosis and Bone Health Awareness Month. We're going to talk a little bit more about that and some things that you guys do to help folks that are suffering from that. But we will come back and we'll discuss more with the doctors from Crystal Clinic Orthopedic Center right here on 1480 WHBC.
Your place for news and what's going on in our community.
First, I do want to thank you, Pam, and I want to thank WHBC for doing this public service.
On Canton's Morning News with Pam Cook.
Family dinners, game nights, and holiday parties. It all happens at home. And we want to help you realize your dream of homeownership. We are the Ohio Housing Finance Agency, and if you're ready to buy a home, we may be able to help. Visit myohiohome.org for more information on down payment assistance, lower interest rates, and more. OFA makes purchasing a home more affordable. Visit myohiohome.org. Home ownership. Make it part of your future.
Hey gang, the Roadman Kenny Rhoda here. Answer this for me. Are you sleeping well? If not, then it's time to get a new mattress, and you can do that by heading to Northeast Factory Direct on Whitewood Street, North Canton. Northeast Factory Direct has mattresses made exclusively for them. We're talking top quality twin, full, queen, and king size mattresses, pillow top, gel foam, and memory foam. They've got it, and all for a fraction of the cost you'd pay elsewhere. Plus, they offer a best price guarantee. So start getting a good night's sleep with a new mattress from Northeast Factory Direct in North Canton. You'll sleep well and save a lot of money.
There are more identity threats than you realize. Even if you monitor your credit, only a little personal info needs to leak out, like your social security number or password,
for you to become a victim.
LifeLock alerts you to threats you could miss. If your identity is stolen, a dedicated U.S.-based restoration specialist will work to fix it. No one can prevent all identity theft or monitor all transactions, but everyone can save up to 25% off their first year with promo code NEWS. Go to lifelock.com.
As a roofer, I'm always on the go, so I need to be able to get things done from anywhere. That's why I partner with Beacon. With the new Beacon Pro Plus app, I've got the brands I depend on, like GAF, right at my fingertips. It's like having my Beacon rep in my pocket 24/7. I rely on Beacon because I never stop building, and neither do they. Now through June, purchase through Beacon Pro Plus and earn up to $1,500. Beacon, always building.
Do you have heart failure and often hear,
"Those stomach issues ruined your birthday"?
"You're too tired to play catch, Grandpa."
"Sweetie, you haven't touched your tools since the carpal tunnel syndrome diagnosis."
If these seemingly unrelated symptoms sound familiar, talk to your cardiologist and ask about transthyretin amyloid cardiomyopathy, or ATTR-CM, a rare and underdiagnosed disease that gets worse over time. Learn more at connecttoyourheart.com. That's connecttoyourheart.com. Sponsored by Pfizer.
From a daily driver, a heavy hauler, or a high-end auto investment, the Sarshone Auto Group is one of Northeast Ohio's leaders, now with 6 locations. Sarshone Ford in Randolph, Alliance in Waynesburg, Sarshone Chevrolet in Randolph, Sarshone Chrysler Dodge Jeep Ram in Dalton, and the Sarshone Auto Gallery in North Canton. The Sarshone Auto Group, an official partner of the Cleveland Browns. Find out more at sarshone.com.
This is an important notice to consumers facing $10,000 or more in credit card debt, medical bills, or other unsecured debt. You may not be required to pay it all back because there are special programs now in effect that will significantly reduce the amount you will owe if you qualify. This is not bankruptcy or a debt consolidation loan. These programs, which the credit card companies like to keep secret, exist to aid American consumers struggling with overwhelming credit card debt by offering tremendous savings and real debt relief. Accredited Debt Relief has established a special hotline for you to call and learn what savings you qualify for. They've helped qualify consumers with over $1 billion in debt and are A+ rated with the Better Business Bureau. So don't wait. Get the relief you need during these hard economic times. For this free information, call the Accredited Debt Relief Hotline now. Call 800-626-0055. 800-626-0055. That's 800-626-0055.
My brother-in-law died suddenly, and now my sister and her kids have to sell their home. That's why I told my husband we could not put off getting life insurance any longer. An agent offered us a 10-year, $500,000 policy for nearly $50 a month. Then we called SelectQuote. SelectQuote found us identical coverage for only $19 a month, a savings of $369 a year.
Whether you need a $500,000 policy or a $5 million policy, SelectQuote could save you more than 50% on term life insurance.
For your free quote, call SelectQuote at 1-800-452-5050. That's 1-800-452-5050. Or go to SelectQuote.com. 1-800-452-5050. That's 1-800-452-5050.
SelectQuote. We shop. You save. Full details on example policies at selectquote.com/commercials.
Now back to Spotlight on 1480 WHBC.
And again, welcome back to Spotlight on 1480 WHBC. Today, we are spotlighting Crystal Clinic Orthopedic Center, and you can join us live on Facebook right now if you'd like to, or on our YouTube channel. just find us by searching 1480 WHBC. I have Dr. Thomas Riley, also Dr. Carrie Diulis, and Dr. Travis Cleland. And we've been talking about Crystal Clinic, but right now we're going to get a little bit more in depth on talking about osteoporosis. This is National Osteoporosis and Bone Health Awareness Month. The month of May is. And I'm going to start with you, Dr. Cleland. Maybe you can describe for us a little bit about what osteoporosis is and, how it's diagnosed and what people might recognize in themselves if they do indeed suffer from it.
Sure. So osteoporosis is an imbalance of bone deposition and bone reabsorption. So as we're active, our bone shifts from being deposited to reabsorbed to create almost a homeostasis of the bone. And by definition, it's low bone density, which can vary from osteopenia, which is kind of a borderline low bone density, to osteoporosis, which is a significant bone density loss. It contributes to about $5.2 billion in healthcare costs annually, so it's a significant economic strain. And it affects about 54 million Americans are diagnosed a year. So some of the risk factors are age. As we age, our bone mineral density can decline, specifically in postmenopausal females are most at risk. Additionally, low weight, so meaning your body weight being less than 120 pounds, puts you at risk. Men with low testosterone are at risk as well. Patients who have had bariatric surgery in the past are at risk, as well as heavy smokers and people who consume heavy amounts of alcohol. As far as, I'm sorry.
No, go ahead.
No, as far as symptoms, though, this is kind of one of those silent things that you don't know until you have an issue. So a lot of people, osteoporosis is non-painful, and typically you don't have any symptoms except for if you have a slip and fall and have what we would classify as a fragility fracture, maybe your first symptoms. So falling from a standing position resulting in a hip fracture or a wrist fracture, and even things called compression fractures of the lumbar spine or sacral fractures can be your first symptom to help with the diagnosis.
Is there a way that you can be tested, or when you should start being tested, like, as a preventative measure?
Sure. So again, kind of utilizing those risk factors, men with low testosterone over the age of 70, as well as women over the age of 60 to 65 can start getting screenings every 2 years. If you have a fragility fracture, that also is an indication for screening. If you have X-ray or CT findings consistent with low bone mineral density, we can screen that. And the test of choice is called a DEXA scan or bone density scan. And we have one of those at our Montrose facility at our outpatient surgical center that we run several times a week to assist with the diagnosis of osteoporosis and osteopenia.
Dr. Diulis, is this something that affects people in the spine? Is this, in other, I'm sure it affects all parts of your body, but is it an issue in your spine too?
It does significantly. In fact, with some of the changes in hormone replacement therapy guidelines, we're seeing an increasing number of these fragility fractures. So, and the other thing that is increasing it is things like celiac disease, which cause malabsorption. So patients who have celiac disease or any of those in that spectrum should be tested much earlier because they may not have deposited enough mineralization in their bones early in life. So then we're seeing people who are getting fractures in the spine, and to Dr. Cleland's point, sometimes they're from falls, but other times the bones can be weak enough that things like coughing, sneezing. I have one patient who was killing a spider, another was reaching for a sweater, and sometimes you just don't know that they occur and suddenly you have pain. And so it's identifying those fractures. Some of them you don't have symptoms from. So we find people sometimes who will have a new one that's very painful, but we'll find that they had an old one, and that's where you see the alignment start to decrease and people get more and more hunched over, which can affect everything, including how your GI tract works. So that's why prevention is so very important.
And Dr. Riley, I'll ask you, we're talking about spine and other part, but does it show up anywhere else? Can you get osteoporosis in your hands or anything like that?
Well, the most symptomatic thing we see is a fall. When you fall and you put your hands out to protect you from hitting your face, breaking your wrist, the radius bone in your wrist is the common fracture we see that happens more. The weaker your bone, obviously, the less you can handle that fall. So the first sign some people know that they have osteoporosis is a broken wrist. Now, a wrist is, can be fixed, and we put plates and screws in their back pretty close to 100%. Obviously, a spinal fracture or a hip fracture can be really much more life-threatening than a wrist fracture. And the problem with spine fractures, it can start a cascade of chronic back pain, and it really can be debilitating. Unfortunately, there's a lot of focus now on our opioid crisis. Well, I see patients that literally come in and the doctors are just trying to help them, but they have them on narcotics for osteoporosis. Well, what they're really on narcotics for is chronic pain from fractures untreated. And Dr. Dulis can kind of go into a little bit about some of that. And preventing the fracture in the beginning, Dr. Cleland can talk about that. Some things that are simple, like just sunlight and vitamins and calcium, and other things more that involve prescription medicine. But these two doctors are more expert on that than the hand surgeon. My care is about when they break a wrist mostly. We get a hint sometimes on an x-ray they don't have good density on bone, but then we'll send them off for the DEXA scan. Osteoporosis is not painful unless you have a fracture. Very unfortunately, medicine tends to make a lot of names sound alike. So osteoarthritis and osteoporosis sound way alike. Osteoarthritis is our condition of a joint where you have arthritic pain, whereas osteoporosis is a description of what happens to the bone when it loses its mineral. So that's a little bit I have patients that say, oh, I'm on medicine for osteoporosis. I said, oh, what are you on? They tell me they're on basically anti-inflammatories. I said, no, that might be osteoarthritis. If they're on osteoporosis, then we need to have a talk with their doctor what they're treating, because that's not something you treat with anti-inflammatory medicine.
Okay.
To add that in, the biggest issue is that once you have one of these fractures of the hip or the spine in particular, the likelihood, the mortality in that year for individuals goes up significantly. So the likelihood of dying within that year, even with treatment, although with the new treatment guidelines, we're much better at improving that, but there's upwards of 30% mortality or more in someone who has a hip fracture from osteoporosis, within that time period. So that's why we're working on, trying to get more people screened early so that we can prevent these fractures.
All right, we'll take our second break here. We have to break for the news. And when we come back, we'll talk more about that and prevention and how important that is. And again, Crystal Clinic Orthopedic Center, that's our spotlight today here on 1480 WHBC.
Do you have heart failure and often hear,
those stomach issues ruined your birthday?
You're too tired to play catch, Grandpa.
Sweetie, you haven't touched your tools since the carpal tunnel syndrome diagnosis.
if these seemingly unrelated symptoms sound familiar, talk to your cardiologist. Ask about transthyretin amyloid cardiomyopathy, or ATTR-CM, a rare and underdiagnosed disease that gets worse over time. Learn more at connecttoyourheart.com. That's connecttoyourheart.com. Sponsored by Pfizer.
The best spring cleaning starts with water from Verndale Water Experts. Act now to get our special offer for a free reverse osmosis drinking water system with the purchase of a high-efficiency twin tank water softener from Verndale Water Experts.
Verndale's Water Center.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC newsroom, Perry local school officials have sent home a letter to parents letting them know that since the levy failed on the May primary ballot, they will go after another money issue in November. They also posted the letter on social media. They said to be prepared for possible cutbacks in the meantime. President Joe Biden and congressional leaders optimistic after yesterday's meeting about the national debt ceiling. Senate Majority Leader Chuck Schumer said the meeting was good, while House Minority Leader Hakeem Jeffries said it was positive and cordial. House Speaker Kevin McCarthy told the press after the meeting it's possible they'll get the deal done by the end of the week. President Biden leaving today for a trip to Japan to take part in the G7 summit, but he has canceled trips to Australia and New Guinea. An unidentified man managed to enter National Security Advisor Jake Sullivan's home in Washington, D.C. in late April. Sullivan was home at the time and confronted the intruder, who apparently got into the home through an unlocked door. A detail of Secret Service agents was stationed outside the home at the time, and the agents did not see the man enter or leave. Sources say the man appeared to be drunk and went to the wrong house. The Cleveland Guardians and Shane Bieber beaten by the Chicago White Sox last night, 8-3. They'll play again tonight with the pregame at 7:35. First pitch set for 8:10 right here on 1480 WHBC. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Sunny, breezy day. High today up to 64. Clear, chilly night tonight. Low down to 38. Sunshine, terrific day tomorrow. The high 75. And then clear tomorrow night, low 58. It'll be breezy on Friday morning. Passing shower, followed by an afternoon thunderstorm. The high on Friday afternoon, 75. Plan with confidence. Check AccuWeather.com. Download the free app today. I'm Steve Williams for News Talk 1480 WHBC.
Spring is here, and if you're clearing out some space at home for a fresh new look, Habitat for Humanity Restore can help. Donate furniture, appliances, building materials, and more with free donation pickup. Call 330-915-5920 or schedule online at restoreeco.org. Free donation pickup makes spring cleaning a breeze at Habitat for Humanity Restore in Canton, the store that builds homes.
Staples has everything your business needs all in one place. Shipping supplies and services so you can fill orders from all over in one stop. Plus professional print and marketing services at your fingertips. And now during Staples Small Business Deal Days, when rewards members spend $100 or more, they get $20 back in rewards plus another $10 back with the Staples Connect app. And you'll find new deals in store every week on tech, chairs, and shipping supplies. Get everything for your business for less at Staples. Rewards offer ends 5/27. Limit 1. Redeemable in-store only.
Now back to Spotlight on 1480 WHBC.
And welcome back to Spotlight on 1480 WHBC. I'm Pam Cook with you on this Wednesday morning. Our Spotlight on Crystal Clinic Orthopedic with 20 locations in Northeast Ohio. And we have with us this morning Dr. Thomas Riley. We also have Dr. Carrie Diulis and Dr. Travis Cleland. We've been most recently talking about osteoporosis. And I'm going to ask you, once you have it, can you get rid of it? Or is it something that you're always going to be fighting for the rest of your life? How does that work?
So there are tests that can be done, like we discussed, the bone density test, and we can monitor those serially every other year. And with appropriate intervention, there is possibility to improve those numbers. The tough thing is as we're young, that Dr. Diulis was alluding to, there is like a bone density max that you attain. So there are some levels that you can't jump past, and doing the best you can to modify your risk factors, utilize medications, vitamins, and exercise can give you the best chance of improving those numbers the best you can.
And some of the original medicines for osteoporosis, their goal was to just slow down the further progression, because we go up in our teen years and then we peak, and then as we start to come down into our 30s and 40s, there will always be a declination of the strength of our bones, and those original medicines are meant to slow that down. There are some newer medicines now that both slow that down and can build some bone. So some of the newer medicines are able to help actually increase that bone density from where you had been at the lower level, and we use those for once it gets severe.
And growing up, it was always like, drink your milk, make your bones strong. And I had 7 brothers that pretty much we beat on each other all the time. And we did have some bones, but usually meant falling off the roof to break a bone. But that only happened to Jim. But I think, Carrie, maybe for the audience, what are some of the non-doctor things you can do?
Well, so that's to your point about doing that. It's load-bearing activities are the thing that are the most important. And, as women, we're not sort of acculturated as we're growing up to lift weights and do things like that, but actually it's critically important. and we get a thing that's got the fancy term sarcopenia of aging, which everybody loses muscle as they get older. But as you lose that muscle, you're more likely to fall. So it's really important to do strength training activities, not only as, you know, younger women, but then especially as we get into the older ages. And so those exercises can help to prevent a fall. But then the strength training, not just walking is great, cardiovascular training is great, but for preserving our ability to move through space and decrease the likelihood of falls, strength training is also really important.
And in terms of vitamins and calcium?
So, Northeastern Ohio, we do not get the sun like the rest of the country does, and that's one of the primary ways of getting vitamin D in addition to dietary ways. So exposure to sunlight, which the dermatologists have their own feelings on, help to, you know, increase our vitamin D, and that's what helps to stabilize our bones. So there are supplements that we can use or dietary sources of vitamin D, and we do measure those levels. And some of the science is sort of back and forth on, do supplements help with that versus sunlight? And in general, we do recommend vitamin D supplementation, especially if we have patients who have fractures.
And what is osteopenia? Because I heard you mention that before, and maybe some people aren't aware of what that is.
So osteopenia is kind of the stage before we get to osteoporosis. So if we're looking at a DEXA scan, they have normal bone mass, then osteopenia, and then osteoporosis. So if you've heard somebody say I'm borderline diabetic or have borderline high blood pressure, this is kind of borderline osteoporosis.
Okay. And so and we're talking about these prevention things, which, you know, all of us can do, you know, the weight training and, you know, the vitamins and things like that. But when do we know it's time to come and visit you besides a fracture? Is there any other time that we know we should come to see you?
Well, I think, you know, those age markers as well as the other risk factors that we talked about. If you know, personally, if any of the listeners have any questions or concerns about it, coming and seeing one of us can definitely, you know, help us identify risk factors. But again, as we age, being postmenopausal for females, having low testosterone for males, those are kind of the things that put you at higher risk for having low bone mineral density. But again, we'd be happy to see any patients that would have any questions or concerns about this to assist them in that.
And I would imagine that there are people out there right now, maybe who are suffering from other health issues, who don't have a chance to do weight training or things like that. You know, what kinds of things can they do, or is there anything they can do to fend this off?
So again, you know, working with physical therapists, sometimes there are things that they can do. We have a fall prevention program and a bone health program that our physical therapists do, that, you know, most people are able to participate in. Again, making sure that you're getting, you know, adequate nutrients in your diet. But then there are some people who need to consider the medications based on where they're at from their DEXA scan, either to help prevent further bone loss, or again, in some cases, to help build bone.
Okay. And Dr. Iolis, I was looking at some of the information about you, and we know that you work with spines, but is it kyphoplasty? Is that how you say it?
Kyphoplasty, yes.
Yeah.
So kyphoplasty is when the bone in the spine it collapses down and wedges forward. So we see those people, you know, the women who get shorter and shorter. The side view is shorter and shorter. Right now it's just
watching on YouTube, yeah.
Right? So we call that kyphosis. And the kyphoplasty, what it does is it's through a very small incision. In fact, I don't even use stitches. I just put a little, we call it a steri strip over it to stick it back together in a Band-Aid. And so through a very small tube, we can put a balloon into the bone that can help raise the height of the bone back up to try and get it to a little closer to where it was. And then we can fill that bone with a special hardening substance that we call bone cement. And they evolved over time so that it's a very safe procedure. And that does help to stabilize that bone, gives almost immediate pain relief. I have patients who, you know, are on pain medications, which are tricky in an older age patient group because of all the side effects of those medicines. And they actually take less pain medicine after the procedure than they did before the procedure. And it's something that we do under sedation. We rarely need to do it under a general anesthesia, although we do it in an operating room. And that procedure gives immediate pain relief, then can get people up out of bed, get them moving, all the things that we need to do to help, improve their overall health and well-being.
And I know you said, osteoporosis itself is not painful, but it's the things that it can cause that are painful. So I would imagine, a person who is hunched over, that can cause people to have some pain. And we were talking earlier about people taking so many pain medications and then, becoming addicted to those kinds of pain medications. So there's a lot that could come from this, isn't there?
There is. And again, as we're changing our overall alignment, so the things that we see in patients are those muscles are pulling in a different way. The joints are being impacted in a different way because you've changed the overall alignment. So even though your fracture was at one level, you may be getting pain from the joints that are at lower levels that now for the first time in your life are being stressed in a different way. But then it can also cause, GI problems. So, digestive problems, because as we get more and more hunched over, there's less and less room for our internal organs. So some patients will end up presenting to the gastroenterologist because they're having, problems. They just can't eat the way that they could. And so it can create this whole cascade of problems. In addition to, if you're not getting up and moving around, you're not taking big, deep breaths in your lungs, that can lead to pneumonia and, further sort of decline in our well-being.
And I'm going to bring this up again too, because we always associate osteoporosis with women and walking sort of hunched over with women, but this isn't limited to just women, is it?
No, I do kyphoplasties on men as well, especially as we're prolonging how long people live. To Dr. Cleland's point, men who have low testosterone that don't get treatment for it, sort of it shifts that curve. But then as we see men living longer, we're starting to see more and more men, and they're not getting screened. And so, it is really important to get those routine screenings for the DEXA scans, both in men and women, once you meet those criteria.
So they just need to contact you. Is that how they would make an appointment? Just contact the clinic and set something up, I would imagine?
Oh, right. I mean, we don't expect people to diagnose themselves at home. And sometimes I have patients that apologize when they come in and it turns out, no, it doesn't need surgery. But really, this is about information. And if our goal initially when we began the Crystal Clinic was not just let's operate more, it was take care of people musculoskeletally and the plastic surgeons, what they do with their reconstructions. So never apologize for coming in and just asking questions. If you have a doctor that doesn't answer your questions, find a different doctor. We have lots of doctors in Northeast Ohio. We all have obviously training in our specialties, but we recruit people that have that extra ability to talk to patients and listen to patients. If that goes away, then talk about artificial intelligence. Well, we're going to be easily replaced with robots if we lose that touch, and because anybody can reattach a finger a machine can reattach a finger, but talking to the patient about what they're going through and questions, because everybody has different levels of understanding, and I don't want anybody ever to feel like they can't ask a question.
Although, just to be clear, at this point, there are no machines that are replacing.
Well, some of my partners, but never mind.
All right, we're going to take our final break right now. When we come back, we'll just
do the robot.
Yeah, very good. That's crystal clear that you can. All right, we'll take our final break. We'll come back and do just a general overview of everything there is to offer at Crystal Clinic Orthopedic Center. And we'll finish up with all of the great information and give you some information on the website where you can go and get that information if you'd like to make an appointment. A lot to talk about. So we will do that here in just a few, right here on 1480 WHBC.
The fastest way to fix is Beck Electric generators and plumbing. When you want it done now and you want it done right, Good, honest work at a fair, honest price. Keep your home in check with a call to Beck. Beck Electric Generators and Plumbing. Beck Electric Company, one call does it all. The fastest way to fix is Beck Electric Generators and Plumbing.
The internet can be an all-you-can-eat buffet for identity thieves.
So full.
Too many maiden names.
And social security numbers.
Where'd you find those?
By the password bar. Can't miss them.
LifeLock alerts you to identity threats you could miss by monitoring your credit and bank statements. If your identity is stolen, a dedicated U.S.-based restoration specialist will work to fix it. No one can prevent all identity theft, but everyone can save up to 25% off their first year with promo code NEWS. Go to LifeLock.com.
Do you have heart failure and often hear,
Those stomach issues ruined your birthday.
You're too tired to play catch, Grandpa.
Sweetie, you haven't touched your tools since the carpal tunnel syndrome diagnosis.
if these seemingly unrelated symptoms sound familiar, talk to your cardiologist. Ask about transthyretin amyloid cardiomyopathy, or ATTR-CM, a rare and underdiagnosed disease that gets worse over time. Learn more at connecttoyourheart.com. That's connecttoyourheart.com. Sponsored by Pfizer.
At Lowe's, we're always bringing pros more ways to save. Right now, get a Flex 24-volt half-inch drill driver kit for only $99. Was $179. That's a savings of $80. Plus, you'll always save big on job lot quantities when buying select building supplies in bulk. Lowe's knows savings. Lowe's knows pros. Valid from 3/20 to 7/20 while supplies last. U.S. only. Lowe's reserves the right to limit quantities. Discount taken at time of purchase.
Finding great people to hire can be like trying to find a needle in a haystack, but not with ZipRecruiter. Their powerful matching technology delivers so many qualified candidates, it's like finding a needle in a needle stack. In fact, 4 out of 5 employers who post on ZipRecruiter get a quality candidate within the first day. For less hay and more needles, head to ZipRecruiter.
And right now, you can try ZipRecruiter for free. That's right, free. At ZipRecruiter.com/free. That's ZipRecruiter.com/free.
Did you know you can get your prescriptions for less at your local pharmacy? You can with GoodRx. It's the free app that can save you money on your medications. Just search for your prescription, choose the pharmacy and the price that works best for you, and then show your GoodRx coupon to your pharmacist at the drop-off counter. GoodRx works at over 70,000 pharmacies, including Walmart, Rite Aid, and Walgreens, and it works whether you have insurance or not. It's easy to save. Next time you drop off your prescription, check GoodRx. To start saving today, go to GoodRx.com. GoodRx is not insurance.
Wesley Financial Group is not a law firm.
This story is called The Ugly Truth About Timeshare. If you think you've done your family a favor by buying a timeshare, you need my help. Hello, I'm Chuck McDowell, CEO and founder of Wesley Financial Group. 10 years ago, I started helping folks cancel their timeshare. And in the process, started what's now called the timeshare cancellation industry. Timeshare is the only thing that you can buy that you can't tell me how much it's going to cost or when it's going to end. When you buy a timeshare, you give them a blank check to fill out any amount they want for annual maintenance and assessment fees. The crazy thing is, this never ends. Even when you die, your family's now going to be stuck with this burden. Stop the insanity today. Call my office now. If we take you as a client, I guarantee we'll cancel your timeshare or you'll pay nothing.
Call for your free information kit. 800-497-9090. That's 800-497-9090. 800-497-9090.
Now back to Spotlight on 1480 WHBC.
And again, we are back with Spotlight on 1480 WHBC. And of course, you can go to our YouTube channel, you can go to our Facebook page, and you'll find this entire hour-long interview there. If you missed any of it at the beginning and you want to check it out, just find us on Facebook or on our YouTube channel, 1480 WHBC. Today's Spotlight is with Crystal Clinic Orthopedic Center and Dr. Thomas Riley, also Dr. Carrie Diolis, and Dr. Travis Cleland. And we've been talking about osteoporosis, but, you know, I'm going to go back to the very beginning when we kind of started things this morning. And Dr. Riley, again, explain for somebody maybe who is just tuning in, just a little bit of background about Crystal Clinic in case they've heard everything and they're thinking, okay, I just want to know a little bit more before I make that phone call to get an appointment.
Well, again, our foundation was trying to have basically a localized place where you could get evaluated, treated advice of musculoskeletal care. So that doesn't necessarily mean everybody that comes through our door is having an operation. We have amazingly well-trained surgical subspecialists covering the gamut from pediatrics to total joints, spine, foot and ankle, hand, shoulder. Pretty much name a musculoskeletal part, we have someone that will take care of it for you that is trained to the highest level, certified to the highest level. And then the evaluations that we talked about from Medicare shows that our outcomes are in the top 1% in the nation, which is awesome. We've also gathered around doctors like Dr. Cleland and his colleagues that do non-operative assessment and care. Some of it is with new technology such as ultrasounds that allow us to do minimally invasive or non-invasive evaluation and treatment. That's really, again, that original goal of 1989. We didn't know what was going to be possible 35 years later, but here we are doing all kinds of things. I should throw out some mention of our plastic surgeons. But initially, we had one plastic surgeon who did hand surgery as well and did a lot of outpatient surgery. So he kind of jumped on board with the orthopedic surgeons. But now we have 6 plastic surgeons. And it's amazingly, it's kind of like, we kind of joke sometimes that we should be breast and bone because the amount of breast reconstruction they do. All of us around here are wearing pink in October. So what is it, Bone Month? But we have a tremendous effort in breast cancer reconstruction with doctors who have come back from training all the way to the West Coast, back here doing deep flap reconstructions that give these women that now are going to live long, but give them closer to what they had before they had cancer to live with. They do a wonderful event every year, a runway event where they bring in patients that they do like a runway where they have beautiful gowns and outfits. And it's just amazing. It takes away some of the stigma of having breast cancer and give people back some self-esteem. So it's not orthopedics at all. Although a hand surgeon likes to operate anything he can get his hands on. But the collegiality with these other doctors has been wonderful. And I think 6, right? Carrie's husband is one of our plastic surgeons. So of our 50 doctors, 6 of them are plastic surgeons, and they work with us on some of the trauma reconstructions that we need, soft tissue flaps and things that they work with us on as well. The cancer, skin treat. We're telling you to go out in the sun to get your vitamin D, but then they'll have to treat your melanomas or your squamous cell carcinomas. But basically, the thing is, don't be afraid to go to a doctor. If you have a doctor already and you want a second opinion, there's no such thing as a bad idea. It's never a bad idea. I'm always sending patients up to get second opinions, pretty much up north, to the guys I know up there that I trust, to get a second opinion outside of our group. And all it's going to do is make me look smarter if the doctor up there agrees. But if they disagree, I want my patient to have that option too. So we're not trying to keep our patients contained within Crystal Clinic. If you need a neurologist, we don't have a neurologist. We can send it to who we think is the best. It doesn't matter who pays them. We can send them to who we think is the best, who we'd send our family members to. So we kind of think of ourselves, it's an ever expanding family. Initially, we're just a dozen doctors, but now we're like 50. But we still like to keep thinking of ourselves as just a very, very big family, which I'm used to dealing with in my family. But it is wonderful. It's been an amazing thing to do something like this. I never thought we'd be doing this kind of thing 35 years ago.
Yeah, that's pretty awesome. Lots of opportunities, lots of doctors to handle whatever it is you might have, and lots of locations. And again, all the information can be found at the website, crystalclinic.com, and 330-670-4006 is the number if you want to ask some questions or make an appointment. And I appreciate all 3 of you sharing all of the great information today with our listeners. I know they got a lot out of this, and a wonderful opportunity for them to find out all about Crystal Clinic. Thank you so much for joining me.
Well, thank you very much for giving us the opportunity to speak to your audience.
All right. Appreciate it. Have a great day.
Thank you.
Spring is here, and if you're clearing out some space at home,